All right, so I'm just going to show you the differences. First off, I want to show you the example of the concern about dead space, or the needle, the amount of fluid that remains in the needle. And so to do that, this is just an empty syringe, and I'm going to draw up a colored solution so that you can more easily visualize this and just imagine that this is a drug that's being drawn up. Most drugs obviously are clear, so you won't be able to see anything. So what I did is I drew up 1 mil in this. And if you look really closely, you can see within this needle, there's green up inside the needle. And so typically what you do, you drop the drug in pharmacy, and because we're needleless, we would take the needle off, obviously dispose of it in your sharps container, and then put a syringe cap on the top of this syringe and send it up to the floor for administration. So the important thing to know is, what are they going to do with this then? Do they have a needleless system where they're going to lac this just into a port, which we'll show you in this week, or are they going to take, part of my reach, another needle and attach another needle to this syringe to inject it? Because if they're going to routinely use needles, so they attach a new needle. If I can get the cap off now, that's really sad. And then let's just say they're going to inject it into the patient. So this is the drug dose they've given, the 1 mil. But the question is, did they really get 1 mil? If you can see right now there's a little bit in that needle hub. And if I follow that up, and I'm just going to take and have some saline here to flush through it. Now it's hard to see because it's pretty faint, but there is green or drug still left in that needle that would not have gotten administered to the patient. Now for most patients, this probably isn't a big deal. You know, when you're talking about an adult patient and you're giving, you know, pretty large volumes. But if you're talking about tiny patients, like I'll see in the NICU that their dose might be 0.2 mils, a lot of those needle volumes can take anywhere between 0.05 to 0.1 mil, and so that could be a significant portion of their dose. And but that's what we call needle volume, or the needle priming volume. To account for that, if your hospital or system is going to be using needles, you'll generally know what needle sizes they use and what those needle volumes are, and then draw back. And so in this case, they might have drawn back, if they knew they were going to use a needle to inject it, drawn back to 1 and 0.1 mils. So that the 0.1 would be the priming volume, knowing that some would be wasted in that needle itself.